Hi, my name is Casey Bowyer. I'm a part of the Princeton class of 2021 in the neuroscience department, and this summer I worked as a part-time research assistant with Dr. Jeanette Curry and Adriana Corder-Waldron. The research that I worked on this summer looks at how New Jersey African American communities are more susceptible to the effects of climate change. And in this study specifically, we're looking at how air pollution in these communities relative to white communities is related to a child's probability of being diagnosed with health issues related to climate change, specifically asthma. This picture that you see on the right side of the screen is a map that logs the African American zip codes, which according to this previous paper that Dr. Jeanette Curry helped write and publish, are those that total more than 50% of the African American population in New Jersey. This paper essentially found that children born in these zip codes have higher incidences of asthma and are also at a greater risk of being diagnosed as asthmatic relative to children outside of these zip codes. The research that I helped with this summer, and I'm currently working on still, uses newly available pollution data in order to determine whether there is a relationship between higher air pollution levels in these zip codes, and even more specific than zip codes, and childhood asthma. Whereas the previous research that this paper came from, or this figure came from, that Dr. Curry had worked on, just found correlational data between living in these communities and having childhood asthma. And a large amount of my time this summer went towards geocoding addresses. Essentially what this means is assigning the addresses of hospitals' patient records a specific location ID that I can pair with the existing pollution data in order to pair the ambient air pollution of where a patient resides and their diagnosis or reason for going to the hospital. The image that you see on the screen now shows a snippet of my notes on going about this process. I worked with the Geographic Information Systems librarian Wang Sering a lot this summer for help on geocoding addresses. First, I would use this program called ArcMap to verify the addresses that the hospital input with a national database. And the next step after that was using ArcGIS. So ArcGIS would input these verified addresses and then assign them GeoIDs that I can then pair with pollution data that had already existing and assigned GeoIDs. The image that you see now is just an example screenshot of what ArcGIS looks like when geocoding data. However, geocoding these records was not really as easy and straightforward as it seems, and a percentage of these addresses failed to find a respective match in ArcMap and consequently did not get an assigned GeoID. This mismatch was likely because the hospital or patient misspelled their address, so I edited an existing algorithm that uses USPS software to correct these addresses. After that, I then reran them through ArcGIS to see if the fixed addresses had now assigned GeoIDs, and it turned out that this process had actually fixed a significant portion of the data, and now the data set was even larger, so I'd have an even larger data set to compare with existing pollution data, which would really help the accuracy of the analysis later on. Running the data through the algorithms took up the majority of my time with this part-time research assistant job this summer. And now that it's finally finished, I'm able to actually analyze the pollution data in conjunction with hospital and demographic records, which I will continue to do and work on this fall as I continue being a research assistant with Dr. Curry and Adriana. Finally, I would just like to give thanks to Adriana and Dr. Curry for guiding me this summer and continuing to guide me into the fall semester and maybe even into the spring. I would also like to thank the Center for Health and Wellbeing, specifically Gilbert Collins and Sarah Goldman, for connecting me with Jeanette Curry and her research after the previous internship that I had planned with the Center for Health and Wellbeing kind of like fell through because of COVID-related issues. And then finally, I would like to thank Wang Sering for being very helpful and patient with me when learning ArcGIS and being just integral to the process of my success with this internship. And I think that's about it. Thank you for listening, and I hope this was a good recording.